Good morning. I am Zeel Patel, and my topic is a study of management of non-critical hospitalized children with clinically suspected viral infections without the use of antimicrobials.
Indoor patients, you mean?
Yes, sir.
Indoor patients without the use of antibiotics. Okay.
The aims and objectives of my study are to know the percentage of clinically suspected viral infections among the non-critical hospitalized children, to study the clinical and laboratory patterns of viral infections in non-critical hospitalized children, to study the clinical course, improvement, or deterioration of viral infections in non-critical hospitalized children without the use of antimicrobials, and to study the impact of antibiotic stewardship strategy in reducing antibiotic usage in the pediatric general ward. The percentage of children who were admitted, among them, the group that was classified as clinically suspected viral infections was 56%. The pattern of fever that was studied that was seen was high-grade fever at onset, regular in occurrence, non-sick child in the interfebrile period with a fair or good response to paracetamol, and progress on day 3 of admission was better. The patient was not worsening on day 3. The CBC in this study population showed a normal leukocyte count in 71% of patients, with eosinopenia seen in 100% of patients, and platelet count was not commentable since 12% showed thrombocytopenia and 22 showed thrombocytosis. The final diagnosis on discharge of children who were admitted with this clinically suspected viral infections was 95.4% were diagnosed to have viral infections and were treated without the use of antibiotics, and 4.6% of them were diagnosed to have some sort of bacterial infection and eventually were treated with antibiotics. The outcome was all these patients were, of them, 99% were discharged successfully. There was 0% expiry noted, and the rest 1% was either DAMA or EBSCON. The antibiotic usage in the pediatrics ward before and after the antibiotic stewardship strategy, excluding the COVID year, was seen that 3.79 times the number of admissions was the number antibiotic or ampules or vials were used, which came down to 2.36 times the number of admissions after the implication of antibiotic stewardship strategy. So my results are, of the total 56% total admissions, 56% was classified under this clinically suspected viral infections. It was found that viral fever pattern could be identified with basic investigations and observation of fever pattern in ward. 95.4% of patients were discharged from the hospital without the use of antibiotics under this class, and no expiry was noted in these patients, and the use of antibiotics was significantly reduced. I conclude from my study that the viral infections account for a big chunk of hospitalizations in non-critical febrile illness, most of which are usually self-limiting and harmless. It is possible to clinically suspect bacterial infections in most non-critical febrile hospitalizations. Serious bacterial infections must be ruled out if few general principles are strictly followed, classically being clinically, fever being high grade at onset, non-sick interfebrile period, regular occurrence, good response to paracetamol, and natural improvement by 3rd or 4th day of illness with or without localization. Laboratory showed CBC with leukopenia with lymphocytosis and eosinopenia with or without thrombocytopenia. It may point towards a viral etiology. However, total leukocyte count and differential count should not be interpreted in isolation without analyzing the clinical profile. After the application of antibiotic stewardship strategy, the use of antibiotics was reduced in wards, and the study generates an evidence for rational use of antimicrobials even in hospitalized children. As evidence-based medicine continues to evolve and adapt, we must strive to redefine our policies from time to time, which will help us enhance our finis as clinicians. Thank you.
Part. I have only 2 questions. Antibiotic stewardship. So you all are the torch bearers, the future generation, to push forward the stewardship program. Okay. So only 2 questions. Why did you admit viral fever who had low grade temperature, and when did you perform CBC? What was the day of performing CBC?
Ma'am, CBC was performed at the time of admission itself, and the admission was based on low-grade fever.
Regardless of the duration of illness?
Yes, ma'am, regardless of the duration. For the study, we had taken CBC on the day of admission for all the
And why did you admit low-grade fever?
Ma'am, low-grade fever, the patient, the way mother characterized the presentation at home, according to them, the fevers were very high. So that way the patients were admitted. As per
Usually
any
we
other
see
symptoms?
virals with
Any
very
other-
high-grade
very high-grade
temperature.
fever. So ma'am, the mothers usually, the way they described was
Okay.
that बच्चे को बहुत ज़्यादा बुखार है.
Yeah, and then you found it was low grade.
जा ही नहीं
Maybe.
रहा है.
Okay.
दवाई देते हैं तो 2 घंटे में वापस आ जाता है. So based on all those mothers' findings that were presented, the presentation of the history that the
You know,
mothers
one saying is there in pediatrics that mother is always right. So why did you characterize or categorize that as low-grade? As per mother's history, you considered it as a high-grade fever.
And
Then why
after
you
that,
categorized it as low-grade?
After admission, the
They
recorded
found low
temperatures
grade.
that were seen, they
Okay.
were classified as low.
Okay.
First day CBC, what's the value? In a viral fever, day 1 of fever, and I'm doing a CBC, it gives me a neutrophilic glucocytosis. Does it point towards it being a bacterial? Yes or no? First day of fever, CBC, you said CBC you did every patient first day. It gives me leukocytosis, neutrophils. Is it a bacterial or still a viral?
So day 1 of fever, we cannot comment, we cannot be very sure about it.
Day 1 CBC may not be.
It cannot be.
How many viral cultures or PCRs you did in the study?
So in the study, because of the lack of availability, we were not able to conduct a lot of PCRs, but the patients who were seen to have critical, we were able to send some.
Critical you did not include.
We did not include in the study. So
What is the cost of viral PCR if you want to get it done?
the panel is 10,000 somewhere.
So your quality of crowd would afford it?
As I said, we are son-in-laws of government. Everything is free for us in the government, isn't it? Jamaica way. Yeah, true.